so much attention to the camera.
Yeah. So pretty
The benefit you guys have is you have this side, okay? And you have something in the uterus.
Doctors at El Camino Hospital tried their hands at an emerging surgical technology Monday. The technique, known as single-incision laparoscopy, employs miniature cameras, tiny LED lights, and special tools which allow doctors to operate on patients through a single opening in the belly button. The hands-on trial was literally wheeled onto the El Camino campus by the pharmaceutical and medical technology company Covidien, whose so-called innovation tour is making its way from coast to coast in a 40-ton, 85-foot big rig.
My name is Chuck Flora. I'm the regional manager for Covidien Surgical Devices. We are in the area today with our sales tour to bring our latest innovative products to El Camino Hospital. So most of our instruments are for laparoscopic procedures, so minimally invasive surgery. The latest and greatest, which we're advertising on the truck here, is our SILS port. That's for single incision laparoscopic surgery. Traditional surgery has always been through multiple ports in the abdomen, and this SILS port allows us to go through a single access in the belly button, and virtually the patients come out scarless.
Inside the 12,000 square foot mobile operating truck was a large demonstration floor where doctors could try the technology at one of 4 stations. Each station included a set of laparoscopy tools which doctors operated while looking at a screen that displayed their movements in real time. According to Flora, single-incision laparoscopy can be used to perform many procedures, such as liposuction, appendectomies, hysterectomies, and hernia operations. And because of the minimally invasive nature of the procedure, the technique is gaining popularity among surgeons and patients.
Patients like that because the cosmetic effects are that it looks like they didn't have surgery. We've also heard from surgeons that another benefit is that there's faster recovery time and perhaps less pain associated with the procedure.
Dr. Patricia Rogers, a gynecologist and surgeon practicing at El Camino, said she was dubious of the procedure's viability, but after a quick session in the Covidien truck, she changed her mind.
Well, I couldn't believe you could do surgery through one incision, laparoscopic surgery. It just, the angles didn't sound like they'd work.
Are you convinced now?
Yeah, it seems like it would work. It's not something that I would go out and do a whole surgery tomorrow with nobody with me who had done it a lot, but with someone who knows what they're doing, somebody who's done it a lot, it seems doable.
Dr. Omera Rivas, assistant professor of minimally invasive surgery at Stanford and early adopter of single-incision laparoscopy, helped demonstrate the technology at El Camino. He said that fewer incisions mean quicker recoveries and a reduction in psychological trauma.
We try to look to innovate for better patient care. And certainly one of the things that I strongly believe is that patients will have much less psychological trauma from having this. For anyone who's had an operation, if you have a big incision, you will always remember that. If you have multiple small little holes, you will still always remember that every day. But if you have only one that you can barely find yourself when you look for it, then chances are you will not remember this, and it's going to be much better. In addition to that, less pain, less chance of getting a wound infection, getting a problem with multiple wounds, etc.